Welcome to the Finding Financial Freedom podcast with the Frugal Physician, where Dr. Disha Spath will be your companion on this exciting financial adventure. Get ready to conquer debt, build wealth, and embrace a mindful spending lifestyle that will empower you to live life on your own terms.
For over 35 years, Corporate Direct has been helping entrepreneurs and investors protect their assets and build real wealth. Founded by Garrett Sutton, a best-selling author and advisor to Robert Kiyosaki's Rich Dad team, Corporate Direct provides professional asset protection, high-quality incorporation services, and strategic advice for real estate and investments. Corporate Direct also assists clients in meeting compliance requirements under the Corporate Transparency Act, ensuring federal reporting is handled with ease and accuracy. Anyone ready to start a business or protect their investments can call 1-800-600-1760 for a free 15-minute consultation or visit corporatedirect.com to learn more. Remember, call 1-800-600-1760. Corporate Direct, your trusted partner in business success. Welcome to Finding Financial Freedom with the Frugal Physician. I'm your host, Dr. Disha Spath, here to help you achieve financial wellness and peace of mind. Today, we're diving into the business side of medicine, how to build a sustainable practice while avoiding common billing pitfalls. Joining us is the incredible Dr. Heather Signorelli. She's a board-certified pathologist, chief medical officer of Vachette Pathology, and the founder of the National Revenue Cycle Management Company. Dr. Signorelli is an expert at helping healthcare organizations navigate the complex world of billing and operations. Welcome to the show, Dr. Signorelli.
Thank you so much for having me. I appreciate getting together and also getting to chat and get to know you a little bit better.
Oh my gosh, I am so happy to have you teach us because you've done this for a while and you do this for large organizations. So just let's dive right in. Could you please just tell us a little bit about who you are, what you do, and how you got here?
Yeah, of course. So pathologist by background, really kind of started out in the business side of medicine very early on. I was consulting in residency, actually doing some crazy consulting agreements outside of the United States, helping other laboratories and hospitals kind of think through business operations and regulatory stuff really early on. And then have been doing that for a large organization for about almost 11 years now. And then about 3 years ago, my husband actually quit his job and we opened a full service medical billing company, which really came about because we were seeing physicians and we were chatting with physicians at some physician conferences that, I had been attending and he had been kind of tagging along. And what we realized is physicians were really struggling with getting the revenue that they deserved, with having a reliable service, with having metrics that they could understand. We just thought with his software background and my background in medicine, we could do a better job. So that's how we're here.
Yeah, 3 years later, you're still kicking. So that's awesome. How did you get into this as a resident?
So in residency, I just kept asking for additional things. I'd have attendings say, hey, do you do anything on the side? What do you do? I knew that I wanted something non-traditional when it came to working in medicine. I just didn't always know what it was going to look like. And I just kept asking. And I'll tell you, I remember being, a sophomore, second or third year resident. And one of my attendings said, hey, I've got this lab in Canada. It was near Saskatchewan. I mean, we're talking rural Canada. Yeah. And he said, you got to get on a plane. You got to get out there. Here's what I want you to look at and write up this report. And I was on this teeny tiny plane with all of these big, mining men. And we went out there and it was quite the experience. But I think I had that entrepreneurial spirit and just took every opportunity anybody would ever give me.
Wow, that sounds like an experience. But how did you even learn about billing as a resident? I feel like a lot of, especially me, as a resident, I was totally blind to like the billing side of things and how all of that worked. How did you learn about it?
I think it kind of came over time. In the beginning, I didn't know, but I've just would sit down with our finance team. I would sit down with our controllers. I would sit down with our denial managers. And even in my full-time role now, I literally would just grasp at anybody who would sit and teach me anything. And that's been a big reason as to how to learn, I guess. You just keep asking. Somebody will actually, people love to talk about what they do. So
Yeah.
you just grab those opportunities.
Yes. Wow. I'm so impressed by that. And the fact that you were able to have the self-motivation during residency while you're still learning to learn about something that was not on the curriculum and reach out and build another skill set, and that's really, really admirable. So I can't wait to learn from you. So let's get to your teaching us. Many physicians dream of running their own practice, but feel overwhelmed by the logistics of building that practice. So can you tell us some tips for building a sustainable practice that you've come across in your practical experience?
I think the first and foremost is start small. I think that where we see practices struggle is that they get overwhelmed by all the things that have to get done. And they don't just start with the first step, right? You've got to come up with a name, come up with a marketing plan, come up with an EMR, and then, build from there. One of the other things that we see practices struggle with is not putting in the right processes from the beginning. And again, you can start small and have the processes around, eligibility or prior auth if you build insurance, or around checking in a patient and how that workflow is going to look like, and stepping along each of those processes. And you as the physician owner really understanding what that looks like, or hiring somebody, whether it's an office manager or somebody to help you define those so that you have a system in place for as you scale, that system scales with you. And I think that that's one of the most important things. Having metrics that you really can measure. And I know that may seem overwhelming in the beginning is, oh my gosh, what are all the things that I measure? Just pick one or two things, and build upon that. I think that that's probably the best advice I can give is start small and do a little bit every single day, add a little bit every single week, every month. And then you'll look back 12 months later and go, gosh, how did I even get here?
Yeah.
I think it's so easy to get overwhelmed with where you want it to look that you don't think through that, you just need to start. It's just day one, just start. And every day you get 1% better. And then next thing you know, you're looking back at what you've built going, okay, this is impressive. So.
Wow. Okay. So what I heard was that you need to really think out the processes. And are you writing them down in like a standard operating procedure and keeping files?
Yes.
Yeah.
I mean, because that's how you train staff, right? So
Right.
as you grow, you have to know what you want from them. One of the reasons why staff aren't happy is that they don't know what they need to do. They don't know the expectations, and they don't know how to do it well. And so if you can craft that, and that can be alongside your staff, it's not you having to come up with everything alone, but as long as you're building that repository of, okay, these are the expectations, these are the 5 things that I need you to do every week. And here's how we're going to step through each of those 5 things and be able to be successful at that. And again, that doesn't mean that in a year you don't update those or change those. It just means you've got to start documenting what your expectations are for each position, what the process is, writing those down. I'm a pathologist, so SOPs are a big, standard operating procedures, SOPs are a big part of my world, but they should be even for small businesses. I mean, we have SOPs from a billing company, and we did from day one. And while they've changed over time, it's really important to think through, okay, start slow, think through what your processes are, write them down, and evolve them over time.
And I can imagine that when someone's starting a new practice and they have time on their hands, more than they will in the future because their patient base is smaller, that's the time to get all this stuff done in the extra downtime that we have.
100%. And again, I think it's easy to get caught up into the perfectionism of it or being perfect with it. I think we've got to let that go and just put something down and evolve it and improve it over time. Again, don't worry about being perfect. Just start and build slowly.
Yes. And any kind of venture, I found that, especially physicians tend to be so perfectionist that we want to get it 100% right. But like the hardest part is just starting and just one step at a time going and learning and just getting your feet in the water.
Yes, agree. 100%.
Well, let's switch to billing then. Billing is a common challenge for many physicians. We all know that working with insurances is not the easiest thing to do. What are some top billing mistakes that you see, and how can we avoid them?
So I've got three top mistakes that I really want to share today. So number one is having a really solid eligibility process. So for those of for the listeners, eligibility is something that you do before the patient comes into the office. It's checking the insurance to make sure it's active and you've got all the correct demographic information. And really doing that is one of the key things we see practices struggle with, and something that really takes a lot of process improvement work with your front desk in order to get that down. So eligibility is one of those top things that we see practices struggle with, and one of the reasons why you can have a lot of lost revenue if you don't get this right. So checking eligibility up front, doing this ahead of the patient coming into the office, and basically correcting any eligibility issues before that patient is seen is going to save you a lot of time, a lot of headache, a lot of money, and going to be able to make your practice more successful. So that's number one. Number two is patient AR, collecting money before that patient is seen. And I know this is like the most awkward conversation to have with a patient is, hey, you owe a copay, or hey, I see you have an overdue balance. Let's settle that up before you're allowed to see the physician. But this is so critical. We see practices with really sometimes hundreds of thousands of dollars of patient AR, of accounts receivable that's due from the patient. And they don't have a great process to explain to patients why it's due, and explain to patients that it needs to be paid, or provide some sort of financial assistance or something. But you got to have a plan. You got to have a plan about patient AR. And that's just, again, it's hard to motivate your front office staff, but it's really something critical everybody needs to be aligned with, so that your front desk know, okay, I'm going to collect all of these balances. They're not going to be able to see the physician until this is done, and that's just the way it is.
Mm-hmm. Well, that sounds like an easy thing to define in a standard operating procedure when you're getting your practice set up. Just, make sure that the insurance is, eligible, and make sure we have all of that documented, all of that fixed before they come in. And then accounts receivable, have that written out as a standard expectation, and make sure the front office staff. And thankfully, this is also something that you don't have to do yourself, right? That you can train other people to do.
Correct. All of this other people should be trained to do. You, the physician, shouldn't be doing it. Obviously, in a small practice where you may be brand new, you're seeing, you don't have a wait list yet. That may be something you're learning alongside too, as you're hiring those first staff. Just depends on how busy you are anticipating scaling and ramping up. Yeah. But hiring out as you should be, these should be tasks you train your front desk to do. And again, those SOPs really come in handy because you define what happens, what reports you need to be pulled, when they need to do it, and making sure that that's kind of on their to-do checklist, and just get that done.
Yeah. So you mentioned metrics earlier. What billing metrics should physicians prioritize to monitor their practice's financial health?
Yeah, and that's my number 3 tip is really you got to have something to measure. For us, we have a standard dashboard that we create for all of our practices. But if you're brand new, or say you haven't started tracking really good metrics yet, the ones that I highly recommend trending is, obviously you want to trend charges and gross revenue, right? What's being billed out and what's coming in. And those are kind of your simple metrics. Mm-hmm. And then as you get into more detailed metrics around your billing process, you really want to track accounts receivable. And you want to understand, is that insurance accounts receivable or patient? Mm-hmm. And then the age of the AR, so how old the accounts receivable is. And what I mean by that is when a claim goes out, right? You see a patient on a Tuesday, the claim goes out on Wednesday. You want to track how long it takes you to get paid. And the older that accounts receivable is, the harder it gets paid. So you want a very small percentage to be over 90 days. So that has to be something you track. And then the last thing is really denials, right? Are you getting denials from the insurance company? And what are the reasons for that, so that you can improve on those month over month?
That sounds very reasonable. What about direct primary or direct care, where people aren't going through insurances, how can they modify? What metrics can they follow?
So it's going to be very similar, right? You're still going to have, what did you bill out, right? And bill out is to the patient versus the insurance company.
Yeah.
And then what did you bring in, right? So still charges and revenue. Instead of thinking of accounts receivable at the insurance, you're still going to be following that patient AR because that's still something you're going to want to make sure you don't have overdue invoices or a process by which you're not collecting what you're billing out. And then probably for a DPC type practice, this is really going to be about volume, right? What types of services do you offer? What volume per each of those services do you see? And then do you have different revenue, buckets that you want to think through? So for example, if you have a DPC practice and say you have products and say you have, seeing the patient in terms of services. So you could track each of those different revenue buckets separately so that you can understand, are you getting a lot of money from products or are you getting more revenue from seeing patients clinically? That would be something to track and trend. And then also expenses. Salary, wages, and benefits tend to be one of the most highest expenses in a practice. And so you want to think through salary, wages, and benefits and your other expenses and trend those as compared to your revenue. So again, these are your typical financial metrics that you're going to want to sit down and really understand what's going on with your practice. And there's more detailed things you can do about how many times a patient is coming to see you, where your referral sources are coming from, how many patients are you getting from those different referral sources. So you could probably go off into a whole tangent to really understand, efforts around marketing and sales, but starting charges, revenue, patient AR, and expenses is probably a good place to start.
Sounds good. So let's go back to insurance billing. Time-based billing can be a little tricky and it's kind of new. Can you explain the nuances of time-based billing and how to ensure compliance with the insurance guidelines around those?
So as you guys know, the coding guidelines changed a few years ago. And so you do want to make sure that you really understand the MDM and the time-based billing and understand there's some really good charts. And I have some I can always send to you guys to send out to your listeners if that's helpful.
Yeah.
That are very important for folks to understand. I think one of the biggest mistakes we see practices do is with time-based billing is that they round up. I spent 45 minutes with the patient. I spent 30 minutes with the patient. I spent 45 minutes instead of really clearly outlining, okay, I spent, 9 minutes doing this. I spent, 13 minutes face-to-face with the patient. I spent 7 minutes reviewing charts and records. And so you really want to get specific. Don't round up and really outline what you did if you expect to do time-based billing as part of your practice. Just like if you're doing medical decision-making or MDM for your billing, you really want to explain, what were the diseases that you evaluated? How did you plan on managing them? And being able to then rationalize, why you're using a level 4 or level 5 code for billing. So really, really important to have really good documentation. I know it's annoying, but it is just the reality of where we're at.
Here's a question. What's the true cost of not having a plan for your finances? With Facet, you don't have to leave that to chance. With their flat fee membership model, Facet is building the future of financial planning. You'll get access to a team of certified financial planner professionals and guidance across tax planning, estate planning, and more. No commissions, no hidden costs, just expert advice that evolves with you. Take the next step in securing your financial future and check out which membership option is right for you. Visit facet.com/frugalphysician today. That's facet.com/frugalphysician.
Are there any tools to help people do that? Because I know when we get busy and we're just trying to, get through the patient, take care of the patient, it's hard to be watching the clock the entire time. Are there any EMR tools that can help us forward?
Yeah, and actually some software systems actually have it built in to where, and it's really neat what some of the new softwares are doing. Modern Med, for example, is one of our softwares that one of our practices uses. Again, we are agnostic when it comes to software, but there are software tools that enable you to document, and actually it will help you craft what the level of billing should be depending on what you document. There are also charts and pieces of paper that if you're more manual, that you can kind of fill in. There's also really cool scribe tools that are starting to come out that are integrating with softwares that are also helping code and help kind of craft your mind into thinking about how you want to document. So lots of new stuff coming. I think a lot of this AI technology is just right on the cusp of really changing the efficiency of documenting, but we're not quite there. It's like this close. So, but it's cool to see some companies starting to come up.
Yeah. I can imagine if someone can build in like, hey, you're in this chart and you just spent, you just reviewed the EKG in the labs and you spent X amount of time doing that. And then it's listening and, writing your note while you're in with the patient and documenting how long that takes, like that could really help boost productivity and really help these companies make a lot more money. So I hope someone listening will build that in to their code. And wonderful. What about critical care time? That's another area that often causes confusion. I see it being used a lot. What are some best practices for documenting and billing critical care services? Because I understand it can be pretty lucrative, but you have to make sure that you get it right.
Again, it comes down to documentation and really understanding each of the CPT requirements. And I know we won't have time to go into depth with those, but it's sitting down and having an educational course with a certified biller, certified coder, I should say.
Mm-hmm.
Like one of our coders will sit down with the groups that we do audits for, and they'll audit the charts, which I recommend everybody doing once a year, and then having an educational session with the coder so you understand the changes. These changes come every single year, and maybe not every CPT, but every single year. Like this upcoming year in 2025, we're seeing lots of changes with telehealth. So when you think through critical care documentation, you've got to really understand what it is necessary for you to document, and are you spelling out what you're doing within that critical care time, where that time is being spent, what physically you are doing for the patient, and having that really spelled out. And unfortunately, as annoying as that is to really tell the story of what you're doing, it is necessary in order to prevent the denials. And for inpatient, physicians who are working on the inpatient side, I really highly suggest sitting down with your, admin team or billing team through the hospital, because a lot of times there are employees as well, and sit down and go, help me understand my denials. Help me understand, are you changing the codes? Are you updating my ICD-10 codes? Help me, understand how I'm doing, because that's going to help you improve long-term. So really highly suggest, time with a certified coder, time going over your specific cases and understanding if you are using them correctly is a very, very important thing that employed or independent, it needs to be done at least once a year, once every other year is really, really critical so that you can know, how am I doing? Because otherwise it's just kind of, you're dropping the codes and may not even know, are you actually getting paid for what you build?
Yeah. I've worked in some practices that will do that. And, sometimes as an employed physician that's not RVU based, you're not even getting that, you're not seeing the numbers of the denials and whatever. So it's easy to get out of touch with the coding requirements. And as much as we all hate meeting with the coders,
I know.
Still, it is important. As much as I dread that meeting coming up, I always come out of it feeling like, oh, I just learned something, and I can implement this going forward. And if that helps the practice do better, that's better for everyone. And I think those meetings are very important. As much as we all like to just stay in our ivory tower thinking about patients, it is important to keep the doors open, right? And we all need to be focusing on that too. You mentioned telemedicine, and that's been in the news a lot recently. So can you tell us a little bit about those changes and how we can bill for telemedicine more effectively?
Yeah, so unfortunately, Medicare is actually rolling back some of the really great telemedicine CPT codes that were in place during the COVID pandemic. And so some of those are actually being deleted. We actually have a blog on all of the details that are coming down from Medicare. So that is expected to come through, and actually it has been approved. It is coming through in 2025. We've had many telemedicine CPTs that were deleted, especially for that audio only portion. And then there are rolling back some of the benefits for telemedicine outside of behavioral health and rural areas. So it's actually an unfortunate situation when it comes to telehealth. It's not completely going away. There are some nuances around this. And again, this is really just clear for Medicare right now. We don't know what the commercial payers are going to do. So we did just post a blog on this actually this past Friday, where we talk all about, this specific changes, just so folks can be aware and speak with their billing team and understand, gosh, what's coming down the pipeline. And it is unfortunate because I think a lot of physicians really utilized telemedicine to help with workflows in the office. You don't need to see every patient in person.
Mm-hmm.
And so it's helpful for the patient to not drive. Sometimes the physician can even do those from home. So we're all kind of waiting and watching and seeing how the industry may change because of this.
Yeah, please send me the link to that blog and I'll put in the show notes because I think this is so important. I mean, there was talk of it being completely uncovered, telemedicine completely going away. And I'm glad at least that's not happening. But it sounds like there's going to be quite a few limitations going forward. And the audio billing going away is unfortunate.
Yes.
Especially in rural areas. I used to practice in a very rural setting, and a lot of my patients couldn't figure out, the video interface method, or the internet wasn't good enough to support video calls, and that's really unfortunate because oftentimes we had to resort to audio because that's all we could do.
Right. And some of those in rural areas where a patient has no access to video will still be intact.
Oh, good.
It. So I think some of those nuances with regards to those will still be available, but it will be something that is much more restricted.
Well, that's unfortunate. Before we wrap up, what advice would you give to a physician just starting out and feeling overwhelmed by the business side of running a practice? We trained as doctors, not most of us don't have MBAs. So what advice would you have for them?
I think first and foremost, find a friend, find a buddy that has done what you're trying to do. And whether that's, truly just a colleague or a friend that you can lean on, or whether that's a business coach or a mentor, or, I've done a lot of coaching in my kind of entrepreneurial life, and it's been very beneficial. And it's every time I do it, I'm like, oh gosh, do I really have to pay for that? And then every time I pay for it, I'm like, oh, but that was so valuable. So highly, highly recommend, whether it's a colleague or something more formal and structured, having something that you can lean on and learn from others. You don't have to do it alone. And I think the other thing is really recognizing that it doesn't have to be perfect out the gate. It just, you have to start and get over that nervous feeling of, okay, what is this going to look like? And then every single day, build upon the process, build upon your staff, build upon your marketing skills, build upon your, financial knowledge. Every single piece will happen over time. You just got to keep grasping for either, information or individuals who can help you, learn a skill that you don't know yet.
Yeah, I think that's so valuable because reaching out and asking for help, that's how you got started doing what you're doing, reaching out and just talking to people, finding people that can teach you and finding people that you can pay to help you. That's the hardest part, I think, of running businesses. But it's also so important. And actually, it's pretty fun to get to know new people. And, that's part of the reason I do this podcast is I get to sit down with experts like you and learn from you. This is exactly, the kind of skill set that unfortunately we don't, as medical trainees, oftentimes we just, we have a very prescribed path and people that will teach us. And that's amazing, right? That's what we need to learn the medicine and the skill of our craft. But to learn business side of medicine, you need to create that path on your own and reach out to people on your own. And thankfully, there are a lot of kind people that are willing to teach. And, there are lots of podcasts, lots of services available. So remember to keep that in mind. You don't have to do it alone. And there are people out there that know more than you. Yes. And they can teach you, and there are skills that we don't know that we can learn because we're smart and able. And so, thankfully we all have the tools necessary to do this. And I think unfortunately in this large institutionalized world of healthcare, it's not working for people, and we all need to try to find solutions. And things are going to be changing in the future. There's a lot of public sentiment around insurance right now. Do you have any thoughts on what's been going on in the insurance world and how that's evolving?
I think it's frustrating. I think everybody goes to medical school and, you're like, I just want to treat people. I just want to help patients. That's what you went to school for. And all of the administrative burden that is involved with managing a patient and then being able to get paid for it is something that we're not taught. And so it is very frustrating to walk out of school and be ready to see patients, but not be ready to deal with the business side. And so I do hope that we start integrating that better. I know that schools are starting to integrate some, but we really, hope to teach folks as much as possible. And then on the insurance side, someone smarter than me for sure is going to have to figure out a solution, because I definitely see, where we're headed is maybe not exactly the place we want to be with all of the complexities around, the pay cuts and so forth. So I'm hoping that, someone smarter than me is going to be able to sort that out. But it is, frustrating. I think the biggest thing that you can hope for, right, is that if you learn from folks who are successful doing it, and there are ways to have successful practices who run really well, who are still billing insurance and still being able to treat their patients really well, that you can do it too. You got to know the rules and, again, not focus on the negative part, focus on the positives.
If there was a healthcare insurance executive listening right now and you had some advice to give them in order to make this easier, what would you tell them?
Transparency with the denials. I think that's the biggest thing that everybody struggles with. And Medicare is really great with this. I know people knock Medicare in terms of billing, but it's very transparent. You know the rules you have to play, you know what you need to do in order to get paid, and they pay you in 2 weeks. It is very cut and dry. I think the commercial payers, we could all have a little bit more of that transparency and not making it so difficult to learn the rules to go by. And so I think having transparency would be something that would be very helpful.
Yeah. Speaking of denials and peer-to-peers, what can physicians do to better prepare for peer-to-peers, and how can we make that process more efficient?
Oh gosh, have your evidence-based materials ready and in front of you, and grit. Those are probably the most frustrating conversations folks have to have. And, someone who's dealt with utilization in a different sense on the hospital side, I get it, but it's really about the evidence-based materials and having the grit to continue to push the healthcare insurance, payer to get what you need for your patient. And I know that that's not what you want to be spending your time doing, because you're not getting the RVUs, you're not getting, paid for that time, but having that material in front of you is really going to be key.
Yeah. I found sometimes as a PCP that if I just put in the CPT code and the insurance, like insurance guidelines for coverage or something like that into Google, then a lot of times a document will come up that the insurance person is using to just go down and tick off those things, right?
Yes, Google is a great resource. And if you know the payer, you know the CPT codes. ChatGPT is also starting. I've kind of been playing around with it, but ChatGPT to say, here's what I'm trying to do. Here's, help me write an appeal letter for this CPT code, and this is the denial reason. And it's actually getting pretty good. So I highly recommend, playing around with some of the AI tools that are out there and leverage as you're trying to fight back.
Yes.
Definitely a worthwhile resource.
Yes, I found ChatGPT to be very useful in just like formatting things and editing things. It's not great for like coming up with data on its own, but if you have like a kind of if you write something real quick, like this is why I need this covered, put it in a ChatGPT and be like, format this into an appeal letter, in a certain style, maintain the facts and the voice of the writer, then it can come up with a very professional looking letter for you within seconds, right? Yes. And that takes away the mental energy of you trying to format something on your own. Just make sure you are proofreading it and make sure all the things that you said are in there.
And you can even take links. So you can, find something from AACP, right? A coding organization, and download a PDF of the guidelines of what you're trying to say. Mm-hmm. And you can actually upload that sort of information so that it is helping you synthesize, a really large document or a really lot of information or data. And it can help you, if you guide it appropriately, it can help you kind of give you some talking points. So again, we're using it to really just, like you said, take what we are already being able to input, take something that we already know and have it spit out either an edited document or things for us to think about. It's actually a really powerful tool. And I think every improvement of ChatGPT is really cool, and all the other new ones that are starting to come out.
Yeah, just I'm not sure how secure it is. I guess we should probably put in a caveat that make sure I take the patient's name out.
No patient information.
Yeah, no patient information. Just fill in that in your letter on the back end.
Yes, no patient information for sure.
Yeah. All right. Well, thank you. Yeah, I think as we go forward, a lot of things in healthcare are going to change. Some for the negative, but a lot for the positive. We're getting a lot of tools given to us from the tech industry that are going to help us make this process better for us. So don't fight it. See how you can figure out how to integrate it into your practice. Going forward, I think AI is going to be very much in healthcare a tool. It's going to be a very powerful tool, and the people that learn it earlier and learn how to utilize it efficiently and in a secure fashion are going to be ahead of the curve, right? So
100%.
Yeah. So make sure you get on that. Dr. Signorelli, thank you so much for joining us today, for sharing your wonderful insights and your expertise. For our listeners, if you enjoyed this episode, don't forget to subscribe and leave a review. Dr. Signorelli, how can they find you if they want to learn more from you?
Yeah, of course. So we have a podcast as well called NatRevMD, NatRevMD. And you can also go to our website we've got a book, a course, podcast, and the blog, like we just spoke about, is all at natrevmd.com. So again, that's natrevmd.com.
Excellent. So what's next for you in Bluffton? You're in beautiful Bluffton, South Carolina.
Yeah, it's 70 degrees today, so we'll hope to be outside. We've got another week or so left of school break, so just hanging with the kids and enjoying water and looks like some sunshine today.
I'm so jealous. All right, well, you might get a visitor soon. Dr. Signorelli, thank you so much for joining us.
Thank you.
Until next time, y'all, stay frugal and stay financially free.
The content shared on this podcast should not be taken as individualized financial advice. We are here to share our knowledge and experiences, but it is crucial to consult with professionals such as accountants, financial advisors, or attorneys who can provide personalized guidance based on your specific needs.